I'm Dr. Jerry Clayton. I'm talking to you here from Children's Hospital here in Aurora, Colorado, a little suburb of Denver, Colorado. And I'm here to discuss with you some of the research that we're doing related to concussion in children, and the fact that we've been using some technology that is being provided to us for our research by the WAVi company. Professionally, I'm a developmental and molecular neuroscientist, and I am the director of research for the concussion program for the hospital. And I've been involved with a large number of individuals that are part of our concussion program to promote and do research on the kids that we see. We see approximately 1,300 to 1,500 kids a year with concussion. We're not too unusual. Many other places around the country see a lot of kids with concussion, and it's very much in the news these days. One of the things that we are trying to understand as part of our research project is that around the world, the only way we have of understanding how severe an injury to an individual is after a mild traumatic brain injury, or what happens as they recover, is to follow their symptoms. In other words, just ask the child, how are you feeling today? And the next time you see that child, you ask them again, and if they're feeling better, you can document that, and that's how we follow our patients. We have a number of treatments that we can utilize, but what we don't have is a really accurate quantitative picture of what concussion looks like in terms of the physiology of the brain. And that's where the technology comes in. And the technology that we are currently using is EEG. There are a number of parameters that we can measure with the electroencephalography that allows us to get a picture of what's going on in the brain. And the way we do it in our program is we look at a lot of kids who don't have concussions, try and understand, well, what does the physiology of the brain look like in terms of all these parameters? And then we have in our clinic a lot of children that have been injured, and we look at them and we try and understand, well, what are the differences between an uninjured child and an injured child? So far, we've seen quite a few kids, and we're at the point now where we're beginning to feel comfortable that we can see the differences between those two. Not only can we see the differences between those two, we're beginning to be able to follow children as they recover, and then try and understand, well, as they report how they're feeling, not only initially, but as time goes by as they recover, is there any association between how they feel and what the physiological measures that we get from the brain doing EEGs look like?